Hi, it's the Nursing Professor here. I want to give you five tips to getting the correct answer on a nursing question. All right, number one is to read that question and almost read it out loud to yourself, like you're a ventriloquist. I can never say that word, but you want to read it out loud to yourself so that you actually can hear it. Because I find students, when we're in class together and I read questions out loud to them, they get the answers a whole lot better. So learn to read to yourself. Now, your teacher might look at you crazy if your mouth is moving, so learn how to get into your own head and do that. Number two is always consider safety as a priority. If you don't have a safe practice, then you can't go any further. An example of that would be this. If you have a question and it says a person is bleeding in the hallway and your choices include assessing the situation, well, that answer that starts with assessment is going to be the correct answer, because you cannot just go and try to stop a bleed without assessing the environment, because maybe there's still a person there with a weapon ready to get at you. So you have to assess the situation first before you can intervene. Nursing process, remember, those steps are in order, they're sequential, and you can't go out of that. Okay, remember ADPI. Number three, consider the ABCs. You know, your airway, your breathing, your circulation. Those are very important. And if you have an answer that includes any of those assessments or interventions, more than likely that is going to be your answer. Number four, consider any answer that includes therapeutic communication. For example, if you have a question and it says the answers given says to encourage your patient, like, tell me more. Do you want to talk about it? Those kind of things like that allows the person an open, free area that they can discuss it. And I tell you, about 95% of the time, that is always the answer if you get any answer that makes you use therapeutic communication, because it's so effective. And number five, last but not least, is that when you're given a choice of answers and you have no clue what they are, cross out those that you know are not the answers. Okay, so given a question, you got four answers to choose from. Two of those you probably can eliminate. So then that brings you down to 50%. You got two more answers that you can consider. And then at that point, really read those answers and try to determine what's the right one. It's a lot better to have a 50-50 chance than it is a 25% chance if you're looking at all four of those answers. So eliminate those answers that you know for sure are wrong, and then drill down to those that possibly could be right. All right, so I hope that helps. Good luck on your exams. Bye for now.